Today we are going to discuss who needs ERCP and who needs cholangioscopy. First of all, what is ERCP? ERCP is an endoscopic procedure which we do under anesthesia to visualize the common bile duct and the pancreatic duct. Common bile duct is a duct which brings the bile from the gallbladder and the liver to the intestine for digestion. So the common complications which we see in common bile duct is stones which get stuck in the common bile duct. And if the stones get stuck, the people may present with obstructive jaundice. Also, sometimes there is narrowing of the common bile duct, which we call stricture of the common bile duct. This can happen due to malignancy, which can involve the pancreas or the bile duct. In these cases, we do ERCP. So what we do during ERCP is put a scope through the mouth under anesthesia and cannulate the common bile duct and, if necessary, the pancreatic duct. If there's any stone blocking the common bile duct, we make a small cut at the bottom of the duct, which is called the sphincter, and make the hole bigger and take the stone out. However, sometimes it's not possible to take the stone out. Then we put in a tube called a stent to relieve the jaundice. Similarly, in case of any narrowing of the common bile duct, we can put stents, the tubes, either a plastic or a metallic stent to relieve the jaundice. The complications of ERCP these days with advanced technology is quite low. There is a risk of pancreatitis during ERCP and a small risk of bleeding or perforation during ERCP. However, the risks are quite low. But in all cases of ERCP, we may not be successful, especially if the common bile duct stone is very large. We are often unable to take the stone out. Sometimes we are unable to cannulate the bile duct because of narrowing or stricture, and that often happens in patients with cancer of the bile duct or the pancreas. In these cases, the role of cholangioscopy is important. Cholangioscopy involves a baby scope which can go through the ERCP scope inside the bile duct. So with the baby scope, we can actually visualize the inside of the bile duct or the pancreatic duct. And if there's any narrowing of the bile duct or the pancreatic duct, we can see them, we can take biopsies to make a diagnosis whether the narrowing is due to malignancy or not. If the stones are large, with the help of cholangioscope, we can use laser or to crush the stone and take the stone out subsequently by ERCP. So the cholangioscopy has improved our diagnosis and therapeutic management of common bile duct stones, of common bile duct stricture, whether it's benign or malignant, to a great extent. So these two procedures, ERCP plus minus cholangioscopy, is nowadays essential to treat these kind of patients. Thank you.